Thanks for the introduction, Luke, and it's been my pleasure to work with some of the people here in this audience, work with the guys at Power Athlete. You know, people that come to our clinic have a lot of health conditions. We kind of run the gamut from, hey, I'm not feeling so hot, to everything like Dr. Tom was talking about earlier today, which is cancer. And so with that kind of eclectic population that I get to work with on a daily basis, it really kind of stretches my mind and stretches my tools that I can use and allows me to basically see a person for the whole person that they are. I look at a person and I don't say, oh, you've got a shoulder injury, or oh, you've got a knee injury, or hey, we're just going to inject this body part and out you go. It's more of a comprehensive approach, because we can't heal the body if we just do spot treatments. Most of us have had spot treatments and they don't work for very long. So if you look at the body as a whole and you kind of take it as a whole machine, then you can fix all the parts. It's kind of like, you know, if you've got a car and all you do is put gas in it and do zero to it besides that, it's not going to get very far after a while. I mean, the gas is going to get you somewhere, but there's a lot of other things that you have to do to that. You have to change the oil, you have to change the tires, you have to change the brakes. Different things like this that are your maintenance. And the body is the same way. The body is a very dynamic machine. It is constantly running. The heart never stops. The lungs never stop. We generally don't stop moving for very long. Most of us probably don't sleep long enough, so therefore we don't get that rest and relaxation and that repair time. So you have to look at it from a global perspective, and everything is interconnected. Again, it's just like the car. The gas tank is not separate from the spark plugs, and your knee is not separate from your shoulder. It's all one. And so whenever we look at it as a group, whenever we look at it as all interconnected, and we put those pieces together, it makes for a well-rounded kind of approach to your health, and it allows you to get healthy, stronger, faster, and all of that to happen much more quickly, and also to be long-lasting. If I just inject your knee and out you go, generally speaking, you're going to come back again with the same injury or a similar injury. Yet if I give you vitamins, minerals, amino acids, fatty acids, like all the components to actually heal the body, along with doing that treatment, and then along with correcting your mechanics and showing you how to walk or ambulate better, and teaching you other techniques on how to lift and move and exercise and do those things in daily life, chances are you're probably not going to come back with a knee injury. And that's what we want. We want to fix you, and we want to fix you not just in your spots, but from head to toe, because we are that dynamic machine. So before I really get started and really get into all of this, I just want to see a show of hands. And I'm going to ask you to raise your hand and then keep your hand up for a second. So how many people in this room have had a surgery for a musculoskeletal injury? Okay, lots of you. Now keep your hands up. How many of you, and kind of take a look around, right? So we kind of get an idea, right? Now how many of you that have had that surgery feel much better after that surgery in that same body part? Now look around. So see, surgery does work sometimes, and it is one of those things that we do need sometimes. Now, if you go out and you fracture your tibia, you're wanting to go to the hospital and you're wanting to get surgery on that to repair it correctly. Yet if you strain or pull or slightly injure a muscle, surgery doesn't necessarily fit that bill, right? And so we have to kind of pick and choose where it's going to be most appropriate. Now, how many of you that did not raise your hand for surgery, how many of you have contemplated surgery for an injury and never gotten a surgery, so you did something else? So how many of you have been injured and did something else besides surgery? Okay, all right. And keep your hands up. Out of those people, how many of you still have problems with that body part? Okay, so see, now again, that gives you some idea if you kind of looked around and saw the audience. So most of you can understand my point of view whenever we start talking about these therapies for treating body parts and treating whatever kind of ails you. And this could be a simple strain all the way through to degenerative joint disease. Going past learning objectives and all of that type of thing, one of the things that I want to talk to you about is one of the injection techniques that I use in the clinic, and that's homeopathic injections. Homeopathic medication has been around for centuries. It's really come into the forefront since the late 1800s, but at the same time, it is a very safe medication to use. It is one of those medications to use on musculoskeletal injuries, and it is scientifically proven. It is, FDA registered, and so it's a very safe medication to use. It does not degenerate tissue like corticosteroids. It can be used on almost any person, meaning there's really no drug-drug interactions. There's no real contraindications. So I can use this on, an elderly person that's coming in and on a whole host of medications and has a whole host of, issues already. I can also use this on somebody who's an elite athlete who's in a sport, a professional sport, and has doping laws, because there's no issues with doping on this. So I can use this very comfortably with almost any person that I want to. So with this, we're going to be looking at the different patients that I can see and how we're going to use this. Now, whenever I say choose patients wisely, what I mean is there's some people that medications work on and some people that they don't. And you have to kind of gauge what type of patient is coming in. Now, most of you guys are, you walk in and you're like, oh, I can take any amount of pain and I've got a high pain threshold and, do whatever you need to do and just stick the needle in and I'll be fine. Well, that's great. Okay, fine. But at the same time, we have to understand where we're coming from and where we're going to. So if you've got 7 out of 10 pain right now, I need to be able to assess that after the injection and then a couple of weeks later and figure out where your pain level is once I do the therapy. So being that true like rhino, like nothing can hurt me, that's not a very good way of assessing. So we need something to kind of be able to assess those patients and how to go about the right therapies. Not every single therapy is good for every single person. So just like some of you raised your hand and said, hey, I had surgery and it actually worked for me. That's great. Some people will get these injections and it works fabulous. I never have to see them again for that particular problem. Others, it's like we do 2 or 3 sessions and it doesn't work. So it's like, okay, what's the next tool in the tool bag to deal with these patients? This is just some research on different homeopathic injectables that can be used. Again, totally safe for just about everybody, and some of the conditions that it's used for. So this is in mainstream scientific research, but this is a very old traditional medicine. This is all, so homeopathic medications in this context, especially with this particular formula, Tramiel, this is all minerals and vitamins and botanicals. So it's all 100% natural. And they've shown that it's just as efficacious as a lot of those other therapies out there. And it can treat conditions, especially things like rotator cuff syndromes and different things like that, without surgery. So it's a simple injection that you can do in the office, maybe once, maybe twice, maybe 3 times, kind of depending on where the severity is and how well your body responds. With just that, it's an in-office procedure, no rehab, no long-term consequences, no scar therapies from surgical interventions, none of that, and very good outcomes. Now, the other thing that you have to look at whenever you're talking about injection therapies, a lot of us have had corticosteroid injections, I'm sure. Not always the best option, but it's one of the things that the orthopedic surgeons and the orthopedic doctors go to all the time. Because what does it do? It stops inflammation cold. You can put a corticosteroid right into that joint and it is going to stop that pain, it is going to stop that inflammation in most patients. Now again, not every therapy works for every patient. So whenever we look at that, we also want to look at toxicity. What is it doing to that tissue? And whenever we look at natural products versus pharmaceutical products, we always want to weigh the pluses and the minuses of each one of those things. And this is looking specifically at toxicity to tissues with different therapies that can be utilized. So just because you're going to your orthopod and he or she is injecting you with corticosteroids and going, oh, okay, we don't have to do surgery, yay, what is that going to do for your tissue long term? Generally speaking, corticosteroids, some of the aesthetics, the anesthetics like lidocaine and those types of numbing agents, if you will, if you use those long term, if you use them again and again, especially in the same tissue, you're going to break down that tissue. You're going to cause toxicity to that tissue. And so this is just looking at some of that information and how we can avoid that. So what can we do to not have those issues with whatever body part we're looking at? This was looking at hamstring injuries. So lots of guys have hamstring injuries, seen a number of them. And what do we do for them? You know, how can we treat them best? And this is looking at injections of Traumeel, which is one of those homeopathic medications. It's also looking at PRP. We'll get into PRP in a little bit. And then how is that stimulatory to the tissue? So how is it causing that healing? It's causing that healing by releasing growth factors. So the body is perfectly able to heal itself if given the right tools. So your body was meant to repair itself. It was meant to live for many, many decades. It was meant to be put under lots of stresses, but we have to give it the tools to repair. If we don't give it the tools to repair, it's not going to be able to do that. And part of those tools for repair is releasing those growth factors whenever those injuries occur. What ends up happening a lot of times is we don't allow the body to have that inflammatory response, or it has an inappropriate response because not all the proper micronutrients are there. Again, the micronutrients are critical to healing that tissue. Dr. Tom talked a little bit earlier today about some of the micronutrient testing that we do for patients. And again, it's just making sure that you have what your body needs in order to repair that tissue. And if you can repair it, then we can help spur that along with a few injections here and there, a few other modalities, and you'll be on your way, and no surgeries, no additional consequences. Now, this is looking at, there's doping laws and everything else. So whenever we're dealing with professional athletes, we have to be extremely careful on supplements and injection therapies and IV therapies and that type of thing that we give, because we don't want to be, responsible in any way for them getting in trouble. So we have to know what is legal and what is not legal in those individual sports. And it varies from sport to sport. So you kind of have to understand what that is. And we look at that, we look at, the doping standards for each year, and we make sure that everything is compliant with that. One of those things is manipulation of blood and blood products. So whenever we do things like PRP, if we're going to give IV therapies, all of that type of thing, we look at that and we make sure that it's in compliance. If we look at things like Traumeel, again, we can use those in various tissues, and we can use it in multiple different types of injections and not be out of compliance with anything. This is looking at inflammation. So in order for the body to repair, it has to have inflammation. Inflammation is a very good thing short term. It is a very bad thing long term. So if you sprain your ankle and it blows up like a balloon, and then a week later it's down to normal and you're starting to walk and ambulate perfectly fine, that is a good repair mechanism in the body. That is the way the body should respond. The problem comes whenever we have an injury, we have inflammation, and then the body doesn't have the tools to repair that tissue, and that inflammation just sits there and kind of festers and keeps going and going and going. And this is what turns into chronic inflammation. Chronic inflammation, generally we think of as anything past 6 weeks, is turning into a chronic situation. Whenever it turns into a chronic situation, there's other things in the body that are influenced. It's no longer a localized issue. now it starts to become an issue with how is the brain perceiving that message? Is the brain going to remap that body part and the nerves to that body part? How is the pain going to be controlled? Even if you fix it, what is the brain going to remember from that injury? And how is that going to change your overall kinetics? So if you're ambulating or walking across an even surface, you want to make sure that that is correct. If the structure is incorrect, earlier this morning, the first speaker was talking about some of that. He was talking about, structure and architecture and making sure that everything is in alignment. If anything gets out of alignment, even if the injury site is fixed, if the alignment isn't fixed, if the architecture, if the ground up is not corrected, if the mapping of the neurological system through the brain is not corrected, then you're still going to have issues. And you're still going to have a area that's in danger of being injured once again, or a distal area, an area outside of that could be injured. You might injure your Achilles whenever you're in, high school or college or something like that. You don't realize that it changes the way you walk. You don't realize the way it changes the way the brain is mapping the rest of the body. You're walking on that for the next 20 years, and now you're 40 years old wondering why you have back pain. That back pain might not necessarily be your back. And everything that you do, you keep going to the doctor, you keep going to the doctor. They keep injecting corticosteroids into the spine. They do nerve stimulators, which is an implantable device that helps confuse the nervous system in that area. There's also processes where they can go in and it's called a rhizotomy. They actually burn the nerves so they can't give any messages to the brain anymore. And all of this stuff, and guess what? The back still hurts. Well, maybe it's not the back. After so long, if you're treating one area and it's no longer being fixed, it's not helping, and you still got pain, you might want to start looking elsewhere because it's probably not that area anymore. It's probably either the neurological connections, it could be something distal or proximal outside of that region. And looking at where is it that's the source or the root of the cause. Part of the reason why our clinic is named Callzenta is because it's what is the root cause of your problem? What is the minute details that are not allowing your body to heal, to repair, and allowing you to have that full, fulfilled, healthy, vibrant life? And until you find out those details that are causing your issues, you're never going to be able to overcome them and excel past them. And I believe that anybody can heal, can recover, can have a fully functioning life and body. We just have to give them the tools to do that. And again, that's looking at those foundations. Without that foundation, you can't build a structure and you can't maintain that structure. Who would ever think of building a building on shifting sand? You wouldn't. You wouldn't think of building a building until the land is perked and the foundation is poured and somebody comes in and assesses the foundation. Then you can start building the structure. And guess what? If a flood comes in and takes out part of the foundation, they go, well, we can't repair the building until the foundation is shored up again. We have to make sure that that foundation is firm and solid. Well, we do that with everything except our bodies. Why wouldn't we look at our bodies the same way we look at a building structure? It's just as important and just as critical. So we have to, again, go back to those foundations, go back to those fundamentals, and we have to make sure that that is stable before we go and start trying to repair the body. And this is for any injury. It doesn't matter what it is. It could be from the most minor injury to the most major health issue that you have. I mean, even in our oncology, our cancer patients, again, we start at the foundation. It's like if we're expecting the immune system to have a response here, we have to make sure that that foundation is solid and firm and give that patient what they need. This is just some more information on inflammation and how if you regulate inflammation, you're going to help the patient feel better, you're going to get increased range of motion, and you're going to get healing. So again, this is more information on how that works, and I'm going to kind of go past some of this and give you guys more of the meat and bones of what we can do with these injections. So this is a Zeal. which is another homeopathic composition that we use for joints. You'll see in a couple of slides from now, there's Traumiel and Zeal that are mixed together and just as effective for osteoarthritis of the knee as a lot of the other Synvisc or corticosteroids out there. So Synvisc is hyaluronic acid, and these are homeopathic preparations. So again, injuries, and what are you going to do for them? Different strokes for different folks, so depending on what your body responds to is what we're going to do for your injuries. Now, this is not a one-size-fits-all. This is not a, this is the only thing you're going to get. We're going to look at different types of mixtures as well, because a lot of times what's the best option for you is mixing a lot of these things together. So we're going to mix maybe a homeopathic with a hyaluronic acid. Maybe we're going to mix a homeopathic with a mineral or a vitamin or something like that, or a botanical. And we can do this and find the best formula for whatever is ailing you and whatever is kind of influencing your ability to heal. And then we're going to reassess that. So it's not just going to be, okay, come in, get your therapy and go home. This is going to be come in, get your therapy, let's assess it, let's figure out if it's working, if it's not working, is it only 50% working? If it's only 50% working, we're going to find out what is the other 50% that your body needs in order to recover and in order to repair and heal, because that is the ideal way of dealing with the body, not just a spot treatment. And whenever we start looking at the different injuries and we start looking at the different modalities that are out there, that's how we're able to put all of these things together. Most people that have been to our clinic, their head starts spinning after about the first day because it's like there's so many modalities that we can do and so many therapies that we can use to influence the body, and they're 100% natural, and most of them are non-painful at all. I would say the most painful thing that we have in the clinic is my injections, and for most of the people that have had the injections, they're like, well, that wasn't nearly as bad as I actually thought it was going to be. And then the other painful part would be if you have to give blood, like John was saying earlier today, whenever he was starting to get lightheaded after about the 50th tube of blood. We don't always pull 50 tubes of blood, but it depends on how much information we want to get as to what we're going to kind of collect from the body. But again, it's about finding those fundamentals and building on that. And if we build on that, we can basically repair whatever it is that we need to. The other thing is edema and inflammation. If you have chronic edema, especially like the edema that is always kind of in the lower limbs, and influencing the ability of the body to circulate from those lower limbs. So if you've got, puffy ankles and puffy feet, and this is happening on a daily basis, we want to address that, because that should not be happening. If you've got, inflammation in the ankle because you've injured your knee and things aren't circulating just in that one limb, that's okay. We can address that and we can deal with that. But if this is a chronic, ongoing thing and you're not injured and you're having edema and you're having swelling in places that it shouldn't be, and you're having it on a daily basis, that's not right. That's not good. And if you're healthy and you're vital and you're moving, your body should not be inflamed. And a lot of times too, we see on these blood markers, whenever we do a whole panel, we see on these blood markers that people have high levels of inflammation and they don't even know it. So sometimes you can have inflammation and not even know it. It's not like you can visibly see it. It might be in the circulatory system. It might be scattered throughout the body. It might be in remote places that you don't even know. But that inflammation is causing your immune system to not function appropriately. It's causing your body to have to react to that, and you're not going to be able to heal. So if you get hurt, you're not going to be able to heal the appropriate way. And the other thing too is if you don't heal appropriately whenever you first get injured, you're going to lay down scar tissue. Scar tissue is usually something that you don't want. You want to avoid scar tissue. Scar tissue is discoherent, meaning if you've got normal structures that are nice and pretty and pristine and they function like a normal muscle should, With scar tissue, it's all gnarly. And even if you can't feel that kind of gnarled up tissue underneath that scar, it is there. And that gnarled up scar tissue is not nearly as compliant. It doesn't give and move like it should, and therefore it's going to be more likely to be injured, and it's going to cause injuries in other places as well, either above or below. So again, you want this to heal, and you want it to heal appropriately. So the faster you can get intervention and the faster you can get your body to actually heal from an acute injury, so you just hurt yourself, the better, because that is what you want, and then you avoid the scar tissue, you avoid the inflammation, you avoid the long-term consequences to the musculoskeletal system and the nervous system. And trust me, if it gets into the nervous system and it's long-term, you've got a road to hoe. You're going to be there for a while, and that's a hard process to come back from. It can be, and that's not a problem, but again, if you can fix it right the first time and have those fundamentals, that is what you need to do. And if you have the fundamentals, everything in life is going to be better. You're going to think better. You're going to feel stronger. You're going to be able to work out the way you want to. You're going to be able to just get up and do whatever it is that you want to do at any given time. And which one of us wouldn't want to be able to do that? So that fundamental basis is what we need. And inflammation is one of those things that we need to make sure that it is not there. So this is that Tramiel and Zeal study that I was talking about. Again, it was compared to placebo, and it was also looked at according to corticosteroids and Synvisc, which is hyaluronic acid. And it's the acronym is the Mozart study, and it's actually being presented in Europe. I think it's 2018 as far as the results. But this is only part of the equation. The other part of the equation is the immune response. And with the immune response, we want to make sure that everybody is happy and healthy. And so this isn't just about injuries. This is also about functioning of the body as a whole. Every system is interconnected. If you've got a crappy immune system and you expect your body to heal from an injury in the gym, it's not going to, because all of those systems are interconnected, and we need to make sure that they are dialed in and that everything is working appropriately. And so this is looking at viral infections. So if you've got an underlying viral infection, it's going to hijack that immune system, and your body's not going to be able to repair. A lot of us don't understand that we're carrying around viruses that are just hovering under the surface. A lot of these viruses are not viruses that we can communicate to another person. These are viruses that we've come in contact with that our immune system is still mounting a response to. It's not just the circulating antibodies that are supposed to be there in case we ever come in contact with them again. This is an ongoing kind of making immune system cells to that viral antigen. And if we don't address that, again, you're not going to be able to repair whenever you get injured. So addressing if there's any viral component is important. The other thing that was lightly touched on earlier today too is any pathogens in the GI tract. So this talk isn't going to be about that, but if you think of your GI tract as being central to your body, about 80% of our immune system is in and around our GI tract. So if we don't have a properly functioning GI tract, if we don't have the right microbes in that GI tract, we're not going to be able to balance, we're not going to be able to heal, we're not going to be able to repair, and that immune system is not going to be up to par whenever we do get injured or sick. This is looking at another homeopathic medication called Engestol. Engestol has been used around the globe in over 50 countries for viral infections. And again, this is a way of dealing with the immune system to bring it up to speed and to allow it to regulate without pharmaceutical medications. This is not an antiviral type of medication that's going to, knock down the immune system. This is not inhibitory to the immune system. This is regulating to the immune system. And again, this is about bringing balance to the body, and that is exactly what we want to do. This is more information on Engestol. This, again, is another component of viral infections and also bringing about regulation to that immune system. Now, don't forget the rest of the toolbox. So this is about bringing in those other tools. Again, it's not about giving you an injection in your knee because you hurt your knee and sending you out the door. This is about looking at it from a global perspective. We are a complex, multifactorial system, and we need to treat our body that way. And if we don't, we're not going to get that resolution that we desire. We're not going to get that permanent healing that we can. And so these are some supplements. This is by far a very limited selection of the supplements that we can give. We have a whole medicinary full of vitamins, minerals, botanicals, etc. That are used for all of these factors. Just to name a few, boswellia, we do a lot for pain, and turmeric, also known as curcumin, for inflammation. And a lot of these, of course, cross outside of musculoskeletal injuries. A lot of these are crossing over into other components. So they're treating that viral component. They're treating, musculoskeletal inflammation and pain, but they're also regulating fibrinogen and fibrin monomers and that type of thing. So regulating blood viscosity and how our body can actually heal and repair. All of those components are very, very critical for healing that injury. And if you don't have all of those components, you're again not going to be able to heal. Devil's claw, white willow bark. Some of you guys probably know, like, white willow bark. It's even made into teas. But this is the old salicylic acid that aspirin comes from. So centuries before aspirin was ever invented, it actually comes from the white willow bark. So quercetin is going to help with decreasing histamine response, stabilizing mast cells, also used a lot in for antioxidants, so protection of the immune system cells. Magnesium to relax muscles. MSM is used to, influence the immune system, decrease inflammation, and restore healthy tissue. Bromelain and quercetin I must have really liked because I repeated them twice. So, but they are used in a lot of our therapies. So it is one of those things where I do tend to see those across multiple protocols that we actually do. And again, looking at it from the whole global perspective. If we don't look at it from a whole global perspective, we're only going to be able to spot treat, and we're not going to be able to get that resolution of the tissue. So this is micronutrient testing, whole blood testing, red blood cells, white blood cells. The idea of doing micronutrient testing in multiple kind of categories, if you will, is that we get an idea of different systems in the body. If we look at whole blood micronutrient testing, it gives me an idea of what's currently circulating at the moment I pull your blood. And that tells me what you have available to your cells at any given point in time. If we look at red blood cells gives us about a 2 to 4 month average based on the life cycle of the red blood cell itself. And that also gives us a snapshot into what is currently being stored in brain tissue, in musculoskeletal tissue, such as the heart and skeletal muscle. So that gives me an idea. Whenever I see micronutrients that are low in red blood cells, I go, oh, okay, so you've been low in this for a couple of months, and your heart and your muscles and your brain don't have these components. And these are, this is things like magnesium, selenium, zinc, calcium, iron. These are major components in the body. We only need tiny amounts of all of these, but we need them. And the thing that we don't consider is that we all try to eat healthy. I mean, which one of us, is going to go out and eat McDonald's every day? Probably none of us. But at the same time, we try to eat healthy, we try to eat organic, we try to kind of follow all these different diets. The problem is that the food that we eat is only as good as the soil that it's grown on. And we have a problem with over-farming in the entire world. So the problem with that is we only replace certain nutrients to that soil every time it's farmed. And so whatever is lacking in the soil is going to be lacking in the plant. Whatever's lacking in the plant can also be lacking in the animal that eats the plant. So if we're eating, kind of top of the food chain with a cow or, buffalo or whatever, they're only going to get the nutrients out of what they eat. They can only eat what's grown from the ground, and whatever is grown in the ground can only have the nutrients from whatever was in that soil. So if the soil is lacking nutrients, which most of it is these days, we're not going to be getting a whole array of nutrients that we should. One of the ways we sort of get around that is having a good diet and also having what we call the rainbow diet. John and Dr. Tom talked about that a little bit this morning as well. That rainbow diet has to be every day, and you're going to choose from a color of the rainbow. So one color of the rainbow and that full spectrum with each meal. So you're going to have red, you're going to have purple, you're going to have green, you're going to have white, you're going to have orange and red and yellow, and green. You're going to have all of these colors in every single meal. And when you do that, and when you start trying to plan your menus around that color spectrum, what that's doing is, one, it's giving you a variety of foods. A variety of foods is going to increase your nutrient levels overall on a daily basis. And it's also going to allow your body to have those nutrients when it needs it and how it needs it. So food is number one. We have to eat right, and we have to get a variety of micronutrients in our food. Second to that is going to be supplements, because we can't always get what we need from our food. We don't always eat right, and we don't always have the nutrients in the food that we're eating, and we can't help that. So that's where we need these micronutrient tests, so that way we can see. If you're extremely deficient in a precursor, we have to give you that nutrient in order for you to do this whole pathway. I was talking to somebody earlier today, and I was talking about pathways in the body. They are not linear. They are multifactorial, and we see this all the time. You take a medication and you've got a whole host of side effects because it's not affecting just one pathway. It's affecting multiple different pathways. And the body utilizes micronutrients all the time. We never know when it's going to need something. So let's say it's going down this process and it needs B12. Let's say you're deficient in B12. You just don't have enough of it today. What happens, the body doesn't go and borrow it from somewhere. The body just goes, well, I don't have that, so I've got to sit here and wait until B12 comes around. And the problem with that is not only does that one process stop, but everything else that's connected and everything else downstream stops. Think about a dam. Whenever you dam up a river, you're going to have a flood, which usually turns into a lake, above that dam, and below that dam, you can dry it up. You can have nothing. So that's the process that the body goes through. We have to make sure that we have all of those micronutrients all the time, and if we don't, the processes in the body are not going to happen the way they should, and there's going to be multiple systems that are affected. The last one is white blood cells. White blood cells are kind of our longest term, so they're a 6-month plus average of what's been deficient in the body. And again, this is looking at the full spectrum of what we can offer the body as far as the micronutrients and the resources that it needs in order to repair. We can't help to repair the body if you're deficient in all these areas. Think of it as different storage components. Think of it, because a lot of times people will do, just white blood cell testing and be like, okay, that's the be-all, end-all. And it's like, no, that's not the be-all, end-all. That's just one storage form. You have to look at all the storage forms, and you have to look at all the micronutrients that you possibly can in order to get that spectrum, that full array of what the body needs. Again, complex system requires complex investigation and complex answers. GI health. This is, again, about 80% of your immune system is in and around your GI tract. Your GI tract is huge. And so whenever we think about that, it is very central to the body. It's centrally located, and it's centrally influenced. The other thing to that is if you're eating all the right foods and the microbes in your gut are not right, you're throwing your food away. Basically, the way we function as an organism is we eat food, feed the microbiome or the organisms in our gut, and they in turn feed us. Without those microorganisms in the gut, without the proper balance of those microorganisms in the gut, we are literally starved of nutrients. So they give us inappropriate ratios, they give us inappropriate nutrients from our food. And when we balance the microbiome in the gut, we find that people are much healthier overall. They can absorb those nutrients and they can correct a lot of imbalances in the body. It also helps with inflammation. It also helps with repair. It helps with immune function. Everything is geared around the gut. And if the gut health is not doing healthy and not doing good and down the toilet, literally, then you're not going to repair. And so it's one of the places that we look. And you know, people don't always like doing stool tests and things like that. Like, oh, please, no, not that, anything but that. And I'm like, okay, that's just part of you, and you have to embrace all parts of you. And you know, this is going to give us a lot of information. And most of the time, once the stool test is done and we analyze it, there's a lot of great data that comes out of that. We've found all types of things. We've corrected major issues that people have had for years, and sometimes even like 10 years, just by fixing the gut. So how long has that gut been imbalanced? Who knows? But it is central to your health and your healing. And so don't forget about the gut microbiome and about helping to stabilize that for multiple types of repair in the body. And if you think you keep getting injured in your knee every time you go and do whatever it is that you're doing, and you're like, I keep repairing this, I'm taking all of these supplements and this isn't working, start looking outside of that area. And one of those places to look is the GI tract, because it is going to be central to your healing and your repairability. CSAP goes along with GI health, and that's just the type of testing that we do. It's a 3-day test, so we get lots of information and we can see what's turning over in the GI tract. Inflammatory markers, again, if you've got inflammation that you don't know about and it's systemic and it's chronic and it's ongoing in the body, you're not going to be able to repair those simple little things that you get, you know, from overdoing it in the gym or, you know, doing whatever it is that you're doing on a daily basis. So inflammatory markers are super critical. And the other component to that is, as we age, of course, everybody thinks of, like, you know, heart health and cardiovascular health. Inflammatory markers are a huge component of that. Inflammation in the cardiovascular system can set you up for risks that are multiple-fold higher than you actually need to be. So simply by lowering inflammatory markers in the cardiovascular system, you're going to save yourself from heart attacks, strokes, clots, and other things like that long term down the road. And so you might not be thinking of what is my life going to be like at the age of 60 or 70, but you can start making an impact and an influence on the health that you're going to have down the road now. And you can do that by checking these markers, and you can do that by influencing the way the body is working as a whole. Again, we're talking about gut health, and I'm also talking about an injury to the knee. Yes, they are related. Yes, they are connected. And by influencing one, you're going to help repair the other. Hormones, it's not enough to just simply take testosterone and think that you're going to be magically all better and you can, like, crush it in the gym. For about 6 months after taking that testosterone and doing nothing else, like not balancing anything else out, you'll probably feel pretty good. And then after that, you start feeling like crap, and you start gaining weight, and you start wondering why things aren't working the way they should be, and why your lifts are going down, and your ability to function is going down, and you've got brain fog, and you're fatigued, and you're like, but I'm still taking the testosterone that they gave me. Why isn't it working? Because it's, again, multifactorial. It's not a linear pathway. You have to look at all of these components. You have to look at all the different hormones and all the different pathways that are involved in regulating that hormonal system. Yes, it can help in certain instances. Yes, it is vital to have proper hormone functioning for males and females. This isn't just a one-size-fits-all. And most of the time, one type of hormone is not the only thing that you need. You need lots of other things to, again, make it a global type of approach to allow you to have that, that health and that optimal healing that you need for any type of injury. Lymphocyte analysis, this is looking at immune function. We can actually measure the way your immune cells, your lymphocytes, are functioning and the number of them. So we can look at the individual lymphocytes, it's called a lymphocyte subset panel, and we can see, are they high, are they low, are they in the right ratios to each other, and this gives us insight on how your immune system is actually working. So we can actually have a very good window into the immune system functioning, and this again is going to help us figure out why aren't you repairing, or why are you creating scar tissue, or why do you keep getting re-injured, or why is it that every 3 months you keep getting an illness of some sort. None of those things should be happening if the body is healthy and able to repair and able to have all of the parameters that it needs for that. So again, if you don't learn anything else from today, it's a multifactorial approach to anything that ails you. And if you only look at one area, if you just have tunnel vision and you're only looking at the spot that's problematic, you're going to miss the big picture. You're going to, you can't see the forest for the trees. It's the same concept in the body. If you've got tunnel vision and you're only looking at one area, you're going to miss the ability of helping to repair and heal that body. Clinical chemistry panels, this is looking at everything from liver function to kidney function to red blood cells, white blood cells, all of that type of thing. Because again, we want to make sure that all your organs are functioning the way they should. If they're not, we're going to correct that. Again, it's all connected. If something's not working in one area, you're not going to be able to heal and repair in another. Amino acids, whenever I think of kind of the building structures in the body, I think of vitamins, minerals, amino acids, and fatty acids. A lot of times people will say, like, what is the bare minimum I need to kind of address or take care of or make sure that I have enough of? And I say, well, the building blocks. I mean, there's lots of other things outside of those, but if you think of the vitamins, the minerals, the amino acids, and the fatty acids, you've got what your body needs to make all of those things. It can make the proteins that replaces the structures, that builds the tissue, that repairs the cartilage, that builds the muscle, that makes the hormones. All of these things are critical and integrated into each other. So this is why we are looking at that whole encompassing person and not just a spot treatment. The other thing, so if we get back into injection therapies and other things to think about besides just homeopathic injection therapies, there's a ton of things that I can use, and I look at the person and I see what's worked for them in the past, where their injury is, why they keep getting re-injured, and then I choose, I kind of have a tool bag, if you will, and I choose what's the most appropriate for the patient based on a lot of information. Most of these guys that have seen me know that the first time I ever see you, we probably sit down and talk for almost 2 hours because I want to get your whole health history. I want to know what you've had done, what your injuries are, what's worked, what hasn't worked, where you're at, so I can get a really good assessment of what I think is going to work for you. After years of dealing with patients in different bodies and all different factors that I look at, I can get a kind of idea as to where to start and what's going to be the most effective treatment for you. One of those is PRP. How many of you guys have heard of PRP and or used it? Okay, good. So this is platelet-rich plasma. The next slide is, the next couple of slides are going to go into a little bit more depth on PRP, only because it's kind of the latest, greatest craze. It's in the line of, so we went from prolotherapy to PRP, and now we're kind of past PRP in some ways into stem cells, and we'll find something else new and great and innovative, I'm sure in about 5 years from now. So anyway, prolotherapy is also very good. That's kind of the forerunner. Prolotherapy has been around for many decades, and a lot of times patients will ask me, well, when do I use this one over that one? Or I've heard that, prolotherapy is the answer to everything. Or PRP is the answer to everything. It's like, we have to choose what you're going to do according to where the injury is and what's causing the injury and what you feel is appropriate for that patient. Prolotherapy is about sclerosing or bringing the tissues together. It's basically causing inflammation, which causes a little bit of a scar tissue, and it's great for laxity. So if you've got stretched out tendons, ligaments, muscles, that type of thing that are just not coming together, not repairing, and not tight enough, a lot of times I've seen this, like baseball pitchers and things like that, once they've thrown those fastballs for many, many, many years, their muscles are just not able to adapt anymore. They're so used to, being stretched to the max, throwing those 90-mile-an-hour fastballs. That's where prolotherapy kind of comes into play. Also, if they're not able to mount an immune response or an inflammatory response, we'll put a little bit of prolotherapy in there, which is a dextrose solution usually. That's typically what's in a prolotherapy solution. Neuroprolo is actually using prolotherapy at a very mild dilution of dextrose, so not very much inflammation, and putting it close to nerve cells. And so that's going to influence the neurological system along with the musculoskeletal system. Neural therapy, ozone kind of got pushed on the same line. Neural therapy is an old school system that's come over from Germany many, many, many years ago, looking at specifically procaine, which helps to reset the voltage of the nerve cells in that area. So what's happening is if you get pain all the time, there's always a pain signal there. So substance P is always being released in an area of injury. What's happening is the body is being sensitized to pain, and so you actually feel pain at a lower threshold. So you might think that you have a high threshold for pain, but if you're chronically injured and you're chronically in pain, your threshold for pain is actually lower. And the voltage potential of nerve cells is actually lowered. So you're going to send that signal to the brain that you have pain in that area sooner rather than later. You don't want that. That's not appropriate. That's not the way we repair tissue. So neural therapy is about resetting those thresholds, resetting that voltage regulation within those nerve cells. And that helps to reset the area of pain along with whatever other modalities you're doing to actually heal that tissue. So it's a kind of a congruent and a therapy that you do together. Ozone, O3, is a phenomenal therapy that we use for multiple different indications. In the musculoskeletal world, it is there to help increase oxygen to the tissue and help to bring about repair to that tissue. So we can use it interarticularly, we can use it intermuscularly, we can use it in lots of different ways. We also use it on other patients for supporting immune system function, combating bacteria, viruses, etc. So O3 has a lot of uses outside of musculoskeletal injuries as well, but in this context it's also one of my tools that I kind of incorporate. So if we look at PRP, 70s was when it kind of was really invented, if you will. Can't really say invented because it's actually a fraction of your whole blood. So, you invented it yourself. It's something that your body does on a daily basis whenever you're injured. We just happen to refine it and use it in a syringe and put it wherever we want it. It's now widely used for joint soft tissue, post-surgical, enhancement of tissue. Basically, what it does, I'm going to fast forward to here. This is whole blood put into a tube of some sort. There's different sizes, there's different structures. Of course, every company out there that does PRP has their little niche in the market, and so they're slightly different from this one to that one to that one. And there's lots of different systems out there. But basically, the short and long of it is I take your whole blood, and we can do this with whole blood, we can do this with adipose tissue, and we can do this with bone marrow. Those three components all have healing abilities when spun down and utilized in the body. We choose from those harvesting sites whether we want whole blood, adipose tissue, or bone marrow based on your indications and what we want to get out of it and how we want to utilize it. But the simple formula is just to use whole blood. And what happens is we spin it down, the red blood cells fall to the bottom. For the most part, red blood cells, you think about in the body, they're mostly utilized to carry oxygen and carbon dioxide. Other than that, we don't want a whole lot of them re-injected back into tissue. It causes bruising and it causes pain and it causes inflammation. You'll see in a minute why we do want some of those red blood cells in there, because sometimes we do want a little bit of that inflammation. But for the most part, red blood cells go to the bottom, we throw those away. Then there's a layer, and this doesn't show it really, really well, but right above the red blood cells, there's what's considered like a buffy coat. and that's the platelet-rich plasma, and then the white fraction is the platelet-poor plasma. And depending on what therapies you're going to be utilizing depends on what fraction or mixture thereof you use. Now, PRP, again, what it does, it takes your blood. Okay, this is only your blood. It spins it down, and I pick out the pieces of your blood that are most likely to help you heal and repair. So this is targeted therapy. This is taking your immune system cells and concentrating them and then injecting them exactly in the point of your injury. If you just now torn a hamstring and I take out pieces of your blood, I pull out the PRP and I inject it right where that tear is, basically what I'm doing is I'm accelerating what the body is already doing by having some of that blood go into that tissue. Whenever you injure yourself, part of the reason why you become inflamed is to allow all of those components of the blood to actually diffuse into the tissue. That's part of inflammation. Inflammation actually opens up the blood vessels, makes them permeable, so it basically creates like microscopic holes in the blood vessels to allow all of those components of the white blood fraction to get in there and heal it. These are some of the components that we get out of that. So this is what's circulating in your blood all the time, and what we're doing is we're isolating that and injecting it back into you. As you can see, most of these are growth factors. The names end in growth factor because they are there to stimulate tissue. They're there to heal the tissue. This is a growth factor to heal the tissue. Whenever we get those components in that tissue, it's going to bring about that healing and it's going to resolve that issue. So the candidates. When do you use one type of PRP versus another type of PRP? We talked about red blood cells. If I don't want a lot of inflammation, if I want, not a lot of pain, not a lot of inflammation, and I just want that healing component, I'm going to use ones that don't have much red blood cell, and I'm going to use a moderate concentration of the platelets. Elderly, inability to heal, inability to tolerate pain, that type of thing. Those are my patients for that type of PRP. If I want more of like a attack you and get it done and over with type of thing, then I'm going to put in a little bit more of those red blood cells. I'm going to make sure that there's granulocytes in there, and I'm going to give you the highest platelet count possible. So again, this is how aggressive you want to be and how much that tissue is able to heal and repair on its own. Again, this is targeted therapy that comes from your blood. I'm just isolating it, concentrating it, and targeting it right back into the tissue where it's injured. This is also used in conjunction with all of those micronutrients, so that way we get that whole body, that whole amount of regulation in the body to repair. And patient profile, fastest results, severe injury to tissue, and they are able to mount an immune response and to heal. What can we mix with PRP? What can we mix with all of these injections? So you have to make sure that the practitioner that is doing all of this work understands what they're doing and how they can kind of mix it up. You don't want certain components with others because they don't mix well. We've all mixed the wrong kind of drinks before and woken up the next day and not felt really good, right? Same thing happens in the body. If you mix the wrong substances together, although they might be good individual, whenever you mix them together, they can counteract each other. So if you're doing PRP, you don't necessarily want to put in a corticosteroid because it's going to negate the effects of the PRP. You also want to be careful with the anesthetics, so things like Procaine or lidocaine. You want to be cautious and put those in maybe at different points in time because, again, you don't want one therapy to negate another. You want them to work synergistically together. So as your practitioner, we look at that and we make sure that what we're putting in works as a synergistic environment, not as a competitive environment. Because if it's competing, we're not going to be getting that healing effect that we want to be. So this is just looking at some of those things to mix and not mix with PRP. Corticosteroids, some of the anesthetics, and vitamins, minerals, that type of thing. Most of the time those are okay. But again, we look at all of those components. And homeopathics, which I started off the talk with, those, again, are shown to be pretty synergistic with PRP, but there are some patients that I still separate those two. So a lot of times I'll do like a pre-injection of homeopathics and then have them come back for the PRP or vice versa. What additional tools do we have? Lots. Like I said, most patients that come to our clinic, they're like, woo, all these therapies and everything that can be done, and we go from therapy to therapy. And they're like, and this does what? And this does what? And this does what? And so again, we're basically looking at that pain, we're basically looking at inflammation, and looking at circulation. So we're looking to regulate all of those components of the body, along with doing the injection therapies, along with creating that foundation, vitamins, minerals, amino acids, fatty acids. And whenever you incorporate all of these other modalities, you're going to get an enhanced effect. And so what you want to do is you want to stimulate the healing of that body. You want to stimulate the functioning of all of those tissues and all of those systems to allow the body to heal and repair. Because like I said at the beginning, the body is completely able to heal and repair itself if given the tools to do so. You know, we wouldn't have been around for millennia if we couldn't repair ourselves. We've only had modern medicine for a very, very short amount of time. What happens to all those other, you know, millions of years that we've been on this planet without modern medicine? We survived. We fought each other, we battled each other, and we still survived as a species. So the body is able to heal and repair itself if given the proper tools to do so, and we're just here to help enhance that. The practice of medicine is nothing more than that. It's looking at the body individually. Every person is an individual. Every you know, pathology that I see is very unique. Have I ever seen anybody exactly like you? No. The answer is no, we haven't. And so we have to look at you as a very individualized person, and what can we do to help repair and to make sure that you have all the fundamentals that you need to do what it is that your body is looking to do. Repair, regenerate, immune system function, etc. And we do that through all of these modalities. Laser therapy for pain and inflammation, infrared therapy for circulation, pain, inflammation, electrical stim for resetting pain reception, circulation, relaxation for increased perfusion, resetting the brain neural pathways, neuromuscular reorientation, again, remapping the way the brain is looking at the body. If you've had chronic long-term pain or injury in an area, you need some of this, because you need the brain to be able to remap that body part and not think of it as just a painful knee. And that does take a while, but that can be done. Massage, exercise, stretching, all of these help to reorient the body and create that environment that allows the body to heal and repair. So again, you know, all of these therapies are looking at the holistic point of view. All of these therapies are being done without surgery, without major insult to the body. Now, if you need surgery, we can still do a lot of these other therapies. So if you need surgery, you still want to make sure all of your vitamins, minerals, amino acids, fatty acids, all of those structures, all of that base, that foundation is in place. Because if you're going to go through surgery, you're going to need that ability to heal and repair after surgery. So it's still critical no matter what therapies you're going to have done. And so the rest of this is just all the data for all the information that I gave in all the slides. So at this point in time, I want to take questions, and I want to for you guys to be able to, you know, ask some pointed questions as far as what we might do or how we might go about some treatments. And like I said, I've treated a lot of these guys, and it's amazing what the body can do when given the proper tools to do so. So think of your body as a whole system, not just a spot treatment, and think of that foundation as being super critical no matter what you're doing. And that foundation is best assessed by testing it and then supplementing or adding to or regulating what needs to be fixed. If something's high or low or not functioning correctly, we need to set that straight. Because again, this is a multifactorial system and everything is very interconnected. And that's going to help you not just at this moment of injury, but that's going to help you literally the rest of your life. So thank you.
Thanks, Dr. Christie.